Hello to all the members of the Doctor's Diary Nepal. Today we are going to discuss about otitis media with effusion. So let's start with the definition. Presence of any serous or mucoid effusion in the middle ear cleft with no pus is known as otitis media with effusion, and it is gradually in onset, and it usually affects the school going children. So basically it is presence of any serous or mucoid effusion in the MEC middle ear cleft with absence of pus. Now let's start the clinical features of otitis media with effusion. So first of all, let's discuss about the symptoms. Talking about the symptoms, there is conductive type of hearing impairment, and it is of gradual in onset or insidious in onset and mild to moderate in severity. That's why parents are not aware about the hearing impairment in their child, and the child may be too young to notice hearing loss by himself. So most of the patients with otitis media with effusion are asymptomatic. Another features or another symptoms of otitis media with effusion is otalgia, that is ear pain. And the third symptom is poor school performance of a child due to conductive type of hearing impairment. Now let's discuss about the signs of otitis media with effusion. First of all, on otoscopic examination, there is presence of ear fluid level, that is crescent site, which is the diagnostic sign of otitis media with effusion. And secondly, the tympanic membrane looks dull, opaque, and lusterless with loss of light reflex. And the mobility of tympanic membrane is also restricted. Now, talking about the signs of the otitis media with effusion, on tuning fork test, first on Weaver's test, the Weaver test lateralized to the affected ear or diseased ear, which suggests about the conductive type of hearing loss. And on Rene's test, Rene's negative is found, which means bone conduction is greater than ear conduction. Now let's discuss about the management of the case of otitis media with effusion. First of all, investigation. If the child is less than 5 years old, we do play audiometry or free field audiometry. And if the child is more than 5 years, we do pure tone audiometry. In pure tone audiometry, it shows conductive type of hearing loss, that is of 20 to 40 decibel, but not more than 40 decibel unless there is ossicular discontinuity. And the second test we can do in otitis media with effusion is tympanometry. Tympanometry shows type B pattern of curve, that is flat or dome shaped. And the third investigation that we can do on otitis media with effusion is X-ray of soft tissue nasopharynx lateral view. It may show adenoid hypertrophy in children or malignancy in adults. Now let's discuss about the treatment options for otitis media with effusion. First of all, we have to notice either there is edema of Eustachian tube or not, and also if there is presence of upper respiratory tract infection or not. And if station tube edema and upper respiratory tract infection are present, we go for medical treatment. And the medical treatment includes topical or systemic decongestant, antihistaminics, antihistaminics like cetirizine, levocetirizine, fexofenadine, etc. And also we start the antibiotics for upper respiratory tract infection like co-amoxiclav. Now let's discuss about the general measures for the management of otitis media with effusion. So we can also perform the Valsalva maneuver, which decreases or resolves the symptoms, and also we can offer chewing gum, which also relieves the symptoms. And if all the measures fail, then we have to perform myringotomy. There are certain criteria to perform myringotomy, and the first criteria is if the effusion persists more than 3 months when bilateral or more than 6 months when unilateral. And the second criteria is there is significant hearing loss that is of more than 25 decibel. And third criteria is speech and language delay in the children. And fourth criteria is complication like otic meningitis or impending cholesteatoma formation. If these criteria are met, then we have to perform the myringotomy at the anteroinferior quadrant with what type of incision? Radial incision. Then aspirate the middle ear fluid, and we have to insert the grommet for continued aspiration. Thank you.